Dr. Ghatan, let's talk about warts, and actually what's kind of like the difference between a normal warts, which cannot be anywhere in the body, as well as a genital warts. I know that you dermatologists deal with this a lot. Can you tell us about it?
Sure. You see, there are many different strains of warts, more than 60 different types of warts.
Wow.
And some types, yes, are known to affect different parts of the body and have different appearance and different ramification in the future. The common warts, as we know it, are the ones that especially children get it on the fingers, on the hands, on the knees, or other parts of the body. These are the most common areas. And the kids get this because the immune system is not as strong yet, and we treat them easily in the office using destructive methods such as liquid nitrogen system. It's basically liquefied nitrogen from air, and the temperature is minus 200 degrees centigrade. It's very cold, and what it does is it destroys the warts. And oftentimes they need to come in more than once to get rid of these warts, and sometimes they combine that treatment with other things to help get rid of warts faster. There are people who come in hundreds of warts sometimes. These people have some sort of immune deficiency that requires a little bit more aggressive combination of treatments. Then there are genital warts or condyloma. Genital warts are common. They are sexually transmitted, as it implies, and they are important to be treated because there is an increased risk of cervical cancer in the female, in ladies. There is also some risk of cancer in the genitals on the males, but not as high as it is in the females. So we do like to first take a biopsy, take a test of this, cut a small piece of the wart, send it to the laboratory to test it, and we are nowadays able to type these warts, and we know there are certain types of warts that are more likely to cause cervical cancer. And if that's the case, then we'll be on the alert, and we can let the other partner know about it and sort of be on the looks for it. And anyway, the treatment is, again, done in the office and at home. We find the combination treatment is more effective. There are creams now that can be applied at home, and then we do the treatment in the office. Most commonly we use cryosurgery, liquid nitrogen, as I mentioned, for the common warts. Sometimes we do use lasers. But we tell patients that need to be treated, and it takes some time. You have to be patient with it. You need to come in every few weeks for the treatment. And we tell them about protection of partners, and also to communicate with partners that they have been found to have these warts, and the partners should be checked out and make sure they don't have it, or if they have it, they should be treated.
Okay.
Then
you wanted to say?
Yes, there is another kind of, it's not a wart, it's called molluscum. Molluscum is another viral infection that's common in children also, and it comes from skin-to-skin contact. And that is also easily treated in the office. Our colleagues, the pediatricians, a lot of times advise the patient not treat them because in about time, sometimes they're going to disappear. Yes, it's true, they disappear in about 2 years or so, but in the meantime they do tend to spread to the same person or to family members, to other children in the family, and they oftentimes become itchy, pruritic, and the person scratches it and gets it infected. And then that's when they come to us with abscesses and boils and things like that, and we have to worry about that and to treat it. So we as dermatologists in general advise the patient to treat molluscum. because it is a contagious disease. And it's easily treated in the office. There are different methods. Again, liquid nitrogen is used by some.
How does a mom? How does a mom notice of what to look for? Because the name is, I don't know. Maybe it's a very common name. I surely don't. I never heard of it. But how does a mom kind of go? Well, wait a minute. This is something we need to treat. What does it look like? How does it look?
It looks like a little. How to describe it? It looks like a little bubble, and the center of it is a little bit. Oftentimes it's depressed in the center. It's small, about a couple of millimeters. Oftentimes 1 to 3 to 4 millimeters in size, and they often could be in clusters. It could be a few, or there could be hundreds of them. It can be on the arm, on the body, on the chest, abdomen, back, face, hands. Could be anywhere, basically.
Okay.
Now, this same molluscum, if it's found in adults, is something that has to be checked out a little bit more carefully, because there is a possibility of it being a sexually transmitted STD problem. And especially if it's in near the private areas or on the private areas, we advise the patients to have other tests for the STDs and to be checked out and make sure there's nothing else is going on. And so the partners have to be checked out, make sure there's nothing else is going on.
Well, all right. Anything else about warts, genital warts, or did we cover that all?
Well, that's basically it. I mean, the treatments are time-consuming, but they're effective for the most part.
What's time-consuming mean? What's time-consuming?
It takes the patients few weeks, few months to get rid of, and they have to be persistent with it. They shouldn't give up.
Okay. And the patient, in those few weeks or few months, most of it is homework for him to or her to do, and for her to do. If it's homework to do, it's like
it's
taking care of it
at home. Right, homework to do at home, and to come to the office every couple of weeks to do in-office treatments.
Sure, I got it. Well, all right. Thank you very much, Dr. Ghatan.